Next item on the agenda is from Calvert County Health Department, Dr. Polsky.
Good morning, gentlemen.
Good morning.
Make sure my clicker is working. There we go. So, welcome to the biannual Board of Health presentation. I know that we're not formally meeting as the Board of Health this morning, but it will serve that same function. So I want to start out before we jump into COVID. I just want to bring up two things because as a community, we should all be aware of public health in general and how things affect. I did mention back in the spring that the Maryland Department of Environment let us know that the Calvert County Health Department was the only health department in the entire state that was able to process all of the septic permits during the 2020 year when a lot of counties were dramatically affected by the pandemic. They just released about 2 weeks ago the actual numbers, so I just wanted to let you all know that it's not just because we have a lower number of septic permits in Calvert. Actually, the opposite is the case. We have the second highest number of septic permits each year that, in Calvert County compared to the other 23 counties out there. So you can see on the chart, or for those at home, it may be a little bit difficult to read, but our staff processed 135 more permits than any other county in the state. The closest was Baltimore County, which has a population about 9 times higher than ours. And so timely processing these permits not only protects the public health, no one wants raw sewage bubbling up in their backyard or coming downstream from their neighbor's backyard, but this is also critical for the economy of the county, that both homeowners and business owners can move on with repairs and with new construction. All right, clicker up. And just quickly along the same lines that for our reproductive health department did yeoman's work last year. And these numbers just got released a couple weeks ago as well, that our county did better in terms of maintaining services to our public than any other county in the state. Really hard work on the part of our staff to adopt to all the changes that had to happen with COVID. We essentially had no loss in services, actually a slight increase in the number of services provided. And reproductive health does some really critical things. We deal predominantly with a high-risk population. These are women, families who are much more at risk for pregnancy complications and preterm births. So being able to do preconception counseling is critical to keep those numbers lower. And year in and year out, our county has one of the lowest preterm birth and pregnancy complication rates in the state. Along the same lines, fewer unintended pregnancies. We have one of the lowest rates of teen pregnancies in the state. Our staff really works hard to make sure that we're reducing the number of sexually transmitted infections. And again, we have one of the lowest rates in the state along those lines. And over the last several years, our staff has gone out of their way that when people are coming in for these kind of services, they also screen everyone for mental health and substance use issues. And so this is one of those referral bases to make sure that people who otherwise would not be identified and would not get services are able, we immediately link them with our behavioral health team so that they can get services that they need. And especially when you look at this population that are predominantly young parents, these kind of services are critically important. One of those days that I was stuck on top of the bridge. And my clicker is invariably working today. Go. So COVID counts. So my slides need to go in a week early to let everyone at home know. We did have a further reduction last week, which was nice to see, although we've seen before where cases can drop 1 week and then go back up the next. We are still, even with the reduction this previous week, we're still in the high transmission range. And you can see if you look back to November and December of last year, that's when we started a very dramatic increase over the winter. So I would just, hopefully we'll see a further reduction over this next week or two, but we're heading into Thanksgiving, and I just want to make sure everyone is aware to continue to act in ways that are going to minimize the spread of virus, particularly COVID, but other viruses as well. We are heading into flu season. And then, so again, these numbers are a week old. Our positivity rate hovered around 5% last week. And then you can see age ranges, and I'm going to flip one more. And you can see, and this, again, this was the week prior, but look, you can see in the adult range, very high positivity rates, and those do correspond with the uptake of vaccinations. So in age ranges where we have the lowest number of, or lowest percentage of vaccinated people, we have the highest percent positivity as far as COVID testing. So just one more time to encourage people to get their vaccines. Statewide, this past week the numbers really didn't change very much, less than 5% change from the numbers that are on the screen. So we're still seeing about 80 to 100 deaths per week across the state related to COVID, 150 people in ICUs, and about triple to quadruple of that of hospitalizations in non-ICU wards, and you can see the number of ER visits. So the next time that you're sitting there in the ER waiting and waiting and waiting, people with COVID are in part delaying care for heart attacks, strokes, and everything else that needs to be dealt with in emergency rooms.
How often does that occur? In
How
Calvert?
often does what occur? I'm sorry.
You just said when you're waiting and waiting and waiting in the emergency room with a heart attack or something like that, people with COVID are clogging up the ER
Well,
or something along those lines.
I can't give you an exact percentage, but I will say that it doesn't matter what the percentages are, even if it's 2% of the time. If you or your family member is the one with a heart attack and they're delayed in their care, that's 1 or 2% more than we should have to see.
Has that happened in Calvert yet?
I'm sure it happens. You know, emergency rooms, regardless of where they are, don't work at a steady state pace.
Understood.
And there are times where there are more patients than ER staff can reasonably handle. So I can with certainty say yes, it has happened, but I can't give you a specific number of times.
Okay.
And then getting back to vaccinations, so at this point we still have 36,000 and change people who are unvaccinated at this point. The bright side, and we've talked about this a number of times, and we've hovered in the top 3 out of the 24 counties in terms of vaccination rates for seniors. As of last week, when I put the slide together, we were ranked number 1 in terms of a best percentage there. But you can see in the adults between 18 and 64, we're middle of the pack. For our adolescent population, a little bit better than that, 8th best, but still certainly not nearly the vaccination rate that in Montgomery County, in Howard County, Anne Arundel, and other counties. And then today, if I wasn't joining you, I would be down at Patuxent Appeal campus because today we are starting to vaccinate 5 to 11-year-olds. And I certainly hope that parents take advantage of that. Currently, we have about 1,250, 1,300 students whose parents have consented for vaccination in the schools this week, and I expect that number will continue to ratchet up. So I'll talk about that just a little bit more.
Is today the first day for that?
Today's the first day. Might as well just talk about it now.
And they send a notice home for parents to sign consent?
Correct. So late last week and into the weekend, I think that almost every school, 2 notices went out, one from central administration and one from the individual schools. We decided, and we had discussions with the medical practices around the county, that the most effective way to get vaccinations to as many children as possible in the most expedient amount of time was to do them in the schools. If we do vaccinate about 1,500 children this week, there's no way that private medical practices could vaccinate that number of children in that period of time. And I'll say that the relationships that our health department is fortunate enough to have with our local providers, that there were some doses of vaccine that were allocated to private practices that were sent to us so that we could use them more efficiently, and with one of our local pharmacies as well. And so my expectation is that after this week, doses we do get in, we will then push them back out the other direction, so that as private practices have more capacity to vaccinate, that we will return the favor and help them as well. The critical thing about this week is that 2 weeks beyond is Thanksgiving. So children who get vaccinated this week, by the time they get together with family, they will already have about 70, maybe 75% immunity against COVID. So not only does that protect them, but it protects their grandparents. And we have to remember that the 0 to 4-year-olds are not eligible yet. And so for younger siblings who have asthma, or if there are infants in the household, they're still vulnerable. And so infections that their older siblings pick up, if they bring those back into the house, it affects generations or affects families in both age directions.
Are there any children currently in the hospital with COVID?
I did not recheck today, but I know that at least over the weekend, we did have one Calvert resident who is up at Children's for COVID-related illness. The illness was severe enough that they could not properly care for the child here locally, had the child need to be transferred. And then, just turning back to the vaccines. And so this is for boosters, and this is broken down by age range. This, again, was as of a week ago. As of yesterday, we were up to 10,267. And we were kind of neck and neck with Howard County in terms of the largest number per capita of booster doses. So these are critically important because we know, especially for people who got vaccinated in the winter of last year, January, February, March, that their immunity is starting to wane. And that's a population that was primarily seniors. So the more people who get boosted, the better immunity going into the winter. And I don't think any coincidence. We did have, unfortunately, an increase in deaths in late September, the first week of October. It was just as we were starting to really get involved with boosters. Over the last month, we have not had any deaths in the county. And so, this is always a probability game, but I think the 10,000 people who have gotten boosted, the majority of which are seniors, that is playing a huge role over the last month in minimizing hospitalizations and preventing fatalities.
So if somebody wants a booster, where can they go?
They can register through our health department. This week we paused because every available nurse vaccinator is out in the schools. But otherwise, we are still providing vaccines 5 days a week. Most medical practices are also making the vaccines available. So at this point, I would say that people can contact their personal doctor and nurse practitioner and see if they can get them there, and also at pharmacies. So there's no shortage of availability at this point. At the health department, we're making available Pfizer, Moderna, Johnson & Johnson. I don't want to get into all again, but I think that's something that deserves a discussion between an individual and their primary care provider as to how they recommend boosting if somebody got Johnson & Johnson as their initial vaccination.
Hey Doc, how long, so say in boosters, so somebody's had their second shot, what's the estimated immunity time? Because you had said like the kids are 70% at that.
Yeah.
What is there, I know it's all new, but what are they estimating as time?
So, and the 70% is with one dose. So it is recommended for children. They also get a second vaccination, just like for adolescents and for adults. And with the second shot, then what the studies are showing is that immunity is up to 91%, preventing for any kind of symptomatic illness, likely close to 100% protection against severe illness, meaning hospitalizations. So again, the 70% was just with the first dose.
For how long though?
With children, it's not clear yet. Children respond better to vaccines than even teenagers and adults, so it's possible that the immunity may last longer. They may not need a boost until maybe a year out, but we talked about this a little bit, it's been a little while ago, that it's not a surprise that 6 months to a year a booster is needed. There are a lot of vaccines, polio vaccine, HPV vaccine, there are a number of vaccines that in the routine series, there's 1 or 2 given in a short period of time, and then there's a booster 6 to 12 months out. And once that booster's given, then in general, people have good immunity for years to come. They don't need to keep getting, you don't go for a polio vaccine every year or for measles. So that booster was expected. the timing for children is something that, again, we probably won't know for a few months. Okay.
Doctor,
and-
in
yes.
reference to the, I'm sorry, go ahead, but before we go off the screen, I do have
Yeah,
a question.
Sure. I haven't, okay. So, again, we've already started to talk a little bit about vaccines for 5 to 11-year-olds. And I think it is important because to discuss this because early on there was this kind of conception that children aren't really impacted by COVID. It certainly is not the case, and especially with the Delta variant. I did a Facebook Live with Dr. Chu and Dr. Mehta last night, 2 of our local pediatricians, and they emphasized once Delta appeared in late summer, how they were seeing more severe cases of COVID in their pediatric populations. So at the moment, and this is just among 5 to 11-year-olds, there have been 8,300 hospitalizations across the U.S. The multisystem inflammatory syndrome, that's where inflammation can be triggered by viruses, in this case COVID, that can impact the heart, lungs, kidneys, digestive tract, brain. The outcome over time for these children is going to be quite variable. You can imagine if a child's lungs get inflamed and scarred, what that may mean for them long term, and certainly for heart. And that 5 to 11-year age range is the peak of seeing these multisystem inflammatory syndrome cases. So particularly for these 5 to 11-year-olds, they are vulnerable to serious complications from COVID. The 714 deaths that have been seen, that's not just limited to 5 to 11-year-olds, but that spans. And the age, if you had to pick 1 year where we've seen the most deaths, it's in infants, and it's 130 of those 745 deaths have occurred in infants. So again, getting back to when your 5 or 6-year-old gets vaccinated, he or she, by not bringing the virus in, also provides protection to your younger children. And then, again, looking the other way, that we know that unfortunately and obviously unintentionally, that children can and do spread infections to older relatives or household members. So I'm sorry, Commissioner Gadway, you had a question?
Yes, please. What is the amount of children, you say that COVID is the 8th leading cause of death over the past year in this age group of 5 to 11. What is that actual number? Do you know?
So for the year itself, so the 745 deaths are over the 18 months roughly, and
Right.
most of that has been recent.
18
So,
months of under 18 years
yeah.
old.
So I don't have, I'm sorry, I don't have a specific number. We could do a little bit of math, but it gets skewed because, again, with Delta, we've seen an increase more
I
recently.
think I found the website where you got that, and it's off the CDC website,
Yeah.
and it actually lists the total deaths out of the 26 million children between 5 and 11, the total deaths
Oh, it's
from COVID.
is it 90, it's 91 or 98?
66.
Okay, I think it's a little bit high. Okay. All right.
Okay.
All right, yes.
And
you're-
it's tied with suicides at the same number in the same age group, 5 to 11.
Yes.
And I just, 8th leading cause of death, and all of them are terrible, I get it. Do you by any chance know how many children have died from the second vaccine shot in the 5 to 11 group?
0.
I'll have to go back and look at the newspapers. I read other articles. Okay.
Okay. And as Dr. Mehta said last night, as we were having our discussion, any one death in this age range is one death too many. So I would, again, impress upon parents that there are a lot of potential implications and ramifications of children getting infected regardless of the age range, and again, encourage vaccination.
Doc, and I know Dr. Mehta very, very well. Is there a way I can view, you said that was a live?
Right.
Okay.
So if you go on our Facebook page, there
Curious
should be
to
a link
hear his
there.
thoughts.
to-
I've known him for
Well,
20
and this
years.
is his daughter Monica.
I just recently met her,
Yeah.
but yeah, he was, and I don't want to misspeak, one of the few people in the county, like 20 years ago, that could even give an IV to infants. I mean, he's very well respected.
Right. And I will say that we are fortunate really across the board to have really wonderful pediatricians and family practitioners in this county. So both Bargash and Monica, they do a tremendous job. And then I know there's been concerns about myocarditis related to vaccination. Just 2 quick points. Number one, the age range we're looking at for 5 to 11-year-olds, this is not myocarditis from the vaccine. This is myocarditis from any cause, the vast majority of which are due to infections with viruses. That the lowest age, when you look at age ranges, the lowest incidence is among 5 to 11-year-olds. What we've seen in older age groups with the vaccine is that there is a bit of mirroring in age groups where you have higher baseline prevalences. That's where we see the myocarditis as a result of the vaccination. So based on this data, although I can't give anything definitive, I will say that the potential for myocarditis in 5 to 11-year-olds as a result of the vaccine is going to be much, much lower than we see in especially 16 to 24-year-olds where you see the most there. And evidence is very, very clear that myocarditis incidence is 10 to 20 times higher for people who get infected with the virus than the potential from the vaccine. And the severity of myocarditis with the vaccine is very limited compared to the severity of myocarditis as a result of an actual virus infection. And then other benefits, certainly health is primary, but fully vaccinated children do not have to quarantine after they become a close contact with someone with COVID. And at this point, about 5,300 middle schoolers and high schoolers in Calvert County have been vaccinated. We have not seen any significant complications for any of them due to the vaccination.
So that's about a third of the population.
Well, we're seeing about 60. So this is just the 12 to 17-year-olds. So it's about 2/3 of the high schoolers and middle schoolers have been vaccinated at this point. And that's reflected by, when you take a look at quarantines, that of all the high schoolers and middle schoolers, the week before, only 22 needed to quarantine. And as the top line shows, that 99.6% of students are able to attend classes. So I would again say that the school nurses, the teachers, they've been doing a wonderful job. We've not been, in some places, when one child in a class ends up with COVID, they just shut a whole classroom down. There's been a lot of effort put into making sure that the only children who need to be excluded are those who truly are close contacts. And our hope is that as we come out of this next month or so and more elementary school students are fully vaccinated, that we'll see that number drop even further, both in terms of infections and in terms of the need to quarantine.
Were you able to get the coronavirus.maryland.gov website to get that information uploaded to them? We talked about it a couple of months ago as far as the data on the state website showing.
I know that our staff has been in contact with them.
Gotcha.
Yeah, so hopefully that.
I just see
that
that
is
some
the case.
schools in Calvert seem to report, but I guess not all. I don't know. Does that go through your office or does that go from the school to the state?
We do contact the state directly. Whether the schools, in addition, I'm not sure.
Okay.
But we do work with the state, and we talk with the state epidemiologists on a regular basis.
Okay. Because, again, like as of last week, there's only 13 cases in Calvert in schools versus what you had listed up on the screen a moment ago. That was 2 at Barstow, 11 at Mill Creek.
So again, these stats are now a week and a half old. We did
Right.
have a further drop last week. I'm not
Gotcha.
sure the 13 is 100% accurate, but we did have a further reduction.
Okay, well, great. Thanks.
All right. And then just to remind everyone out there as we kind of shift that Affordable Care Act health insurance enrollment opened on November 1st. In years gone by, it is closed on December 15th. This year, it extends. I'm sorry. I'll get to that next. As far as the dates, so enrollment options are any U.S. citizen who resides in Maryland. If you reside in Virginia, you got to go to Virginia to enroll, and that children and pregnant women often qualify for insurance at no cost, which also includes dental coverage, which I think if we take a look at one sector of healthcare where people are least able to afford care, it's with dental coverage. And for those who are not children and are not pregnant, there is supplemental dental coverage available for most people. And then, sorry, this.
Where would people go?
There we go.
Where would people go if they are enrolled into the ACA, they're paying their premiums, but yet Maryland bumps them out of the system for a couple of months and automatically renews them in order for them to be able, I guess, have the tax implication for not having it throughout the entire year? Particular person I know has contacted 6 attempts to try and get the coverage straight, showing the proof that the premiums have been paid
That's a
and
state,
collected, but where does,
I think that's a state controller question. That's not a local
Okay.
health department.
I
So
didn't know if
I'm-
there was somebody in the local, you're promoting it, so I didn't know if there was somebody in the local health department that they could go to seek assistance on that.
We can show we can show proof of insurance, but we certainly can't absolve people of their tax issues. So that would,
Well, no, it's a tax issue because the Maryland State Health kicked them out of the system, just removed them from the system arbitrarily for a small period of time.
so there, people
There's
are welcome.
hiccups in the system.
People
Where
are,
do
people are
people
welcome
go
to
get
call
those?
our health department, and we do have a few staff who their job is to help people with enrollment, and they hopefully would be able to verify for people, give them some documentation that
Super.
was the
I'll
case.
I'll send them your way. Thank you.
All right, not a problem. So I'm sorry, I started to mention about the coverage on the last slide. If people enroll by December 31st, their coverage starts on January 1st. For those who delay, they do have until January 15th to enroll, but their coverage would not start until February 1st. So certainly encourage people not to wait to the last minute. Many people qualify for some type of assistance to make insurance more affordable. So people should not assume arbitrarily that insurance would be not affordable for them. And certainly we see what healthcare bills can do to families. Still, to the best of my knowledge, a leading cause of bankruptcy in this country are healthcare bills. And there's both a website and a toll-free number that people can call. I'll just make quick mention, not so much the incredible medieval stained glass on the left side, but a shout out to our county attorney. On the right side is a stele from sits in the Louvre that shows Hammurabi getting the code of laws from the sun god back in ancient Babylon. And in the bottom part are 282 laws, the first set of laws down. Commissioner Weems and Commissioner Hart might be interested that among those 282 laws, it's very much an eye for an eye, tooth for a tooth back in ancient Babylon, that for wine merchants who were found watering down their wares, the punishment was drowning in the river. Because if you're going to water down your wine, they're going to water you down.
As they should be.
There you go.
It's true for liquor store owners today, too.
Nobody wants a watered down drink.
Absolutely not. And then kind of wrap up, influenza, we can't forget about that. That there are years where hospitals will fill up just with flu patients. And there's also business implications. So as I've mentioned in previous years, it is in employers' best interests for their staff, their employees to be vaccinated, that on average businesses lose $135 per day when staff are out because of the flu, and that doesn't take into account when people show up kind of foggy and not doing their jobs very well and make mistakes that sometimes will end up driving supervisors and business owners to distraction. And side effects from the flu vaccine, extremely rare. So the bottom of the slide, your chances of dying from the flu is 50 to 100 times greater than your chances of having a bad reaction to the vaccine. So just remind everyone that we've been vaccinating people since back in the start of this nation, that vaccines have always been extremely safe, and even more so in modern times. And that people should not be dissuaded from things that sometimes they see on social media that have no basis in fact. That if you have concerns about the safety of vaccinations, please talk to your personal physician or nurse practitioner. And then I will finish up mentioning something that I know that Colonel McDowell was talking about earlier today with substance use, and mental health gets tied into this as well. That I mentioned previously that our county has had the largest drop in overdose deaths of any county in Maryland over the last 3 years. We have just got data for the first 9 months of this year, and we had an additional 16% drop in overdose deaths in the county. A little bit of perspective, so our neighbor to the north has a population about 6 times greater than Calvert, but they have 10 times the number of overdose deaths. So we still have work to do, but collectively, and there have been a lot of people across the county that have really pitched in meaningfully, collectively we still have some work to do. And for people who do want to get vaccinated, whether it's a first vaccine or a booster, there is our website. You can log on and register, and phone number that you can call, or as we mentioned before, you can call your personal doctor or nurse practitioner. Happy to take any additional questions.
To go back to the hospitalization and the ER that you were talking about earlier, how many people do you know are currently hospitalized in Calvert due to COVID, and how many are in the ICU currently? Do you know?
As of yesterday, 7 people were hospitalized due to COVID, 1 in the ICU.
Gotcha. Okay, so 1 person in the ICU. Got it. And 7. Thank you.
Okay, you're welcome.
I think we're good.
All right.
Thank you, Dr. Polsky.
Thank you, Doc.
Thank you all.
Have a good day.
Thanks. You too.
you.